Two public health threats are intersecting and putting at risk the health of gay, bisexual, and other men who have sex with men in the United States, according to new CDC research being presented here at the 2018 Conference on Retroviruses and Opportunistic Infections. Hello, everyone. I'm Steve Holman with HIV.gov, and we're pleased to be able to record this interview today from the conference with Dr. Jonathan Mermin, Director of CDC's National Center for HIV, Viral Hepatitis, STD, and TB Prevention. Welcome, Dr. Mermin.
Thanks, Steve. It's great to be here at the conference with you.
Glad to have you. So, Dr. Mermin, what are these intersecting threats that are impacting the health of gay, bisexual, and other men who have sex with men?
Well, Steve, Dr. Jeremy Gray and his colleagues in STDs at CDC thoughtfully recognized that men who have sex with men have a risk of acquiring syphilis that's over 100 times higher than the risk for heterosexual men and women. And they also had noted that men who have sex with men who also have HIV infection are at an increased risk. And they wanted to know how much was that increased risk and did it apply across the country. So they did an analysis by state, and what they found was that MSM who have HIV infection have an 8 times higher risk of acquiring syphilis than men who have sex with men who don't have HIV infection. And ultimately, for MSM with HIV, that was about a rate of 1 per 100 per year of primary and secondary syphilis, the kinds of syphilis that are infectious and indicate that you were recently infected with the bacterium.
Interesting. So tell us more about the connection between HIV and syphilis.
Well, there are really two issues. One is that syphilis increases the risk by about 2 to 5-fold that a person will acquire HIV infection or that a person with HIV will transmit HIV to somebody else. So syphilis puts you at risk for acquiring or transmitting HIV. In addition, syphilis can be more severe in people with HIV infection as well.
So, what role does screening then play in both HIV negative and HIV positive men who may be living with syphilis?
Well, getting tested or being screened, meaning having a routine test for syphilis, is really important for people with HIV and gay and bisexual men who don't have HIV because syphilis is so prevalent in the community. If you get diagnosed with syphilis, you can get treated. There's very effective antibiotics that will cure your syphilis infection. If you don't get treated, though, syphilis can cause some severe outcomes, and we've been seeing that occur even more frequently among people with HIV recently, including blindness, stroke, and other kinds of neurological complications that normally occur infrequently with syphilis. We're seeing more frequently now in the United States. So getting tested if you're finding yourself at risk for syphilis, and then getting screened routinely if you have ongoing risk can be very important.
So you just said something interesting there that some folks in the audience may not be aware of. What puts you at risk for syphilis? How would someone know if they should go ask their doctor about being tested?
Right, so syphilis is a sexually transmitted disease. In its initial primary form, it causes what we call a chancre or a sore, which is painless. And then that resolves, and you go into secondary syphilis, which can transmit syphilis to other people, just like the chancre can. And then ultimately, if it's untreated, it can go into later stages of syphilis that can cause some major complications in terms of people's health. So having sex with people is what puts people at risk for syphilis and HIV infection, and it's part of the reason that these two epidemics are intersecting.
That explains it. So the analysis that CDC presented here at CROI digs into some state-level assessments for 34 states. People who are interested in this topic might want to visit the CROI conference website to take a look at the poster and learn more about the findings that CDC presented here. But Dr. Mermin, on a more practical level, what do these findings mean for healthcare providers who may be seeing men who have sex with men in their patient load, and for individual men who have sex with men? What should both be doing now in light of this information?
I think it's really important that if you are a gay or bisexual man, that you think about getting tested for syphilis. And you can ask your provider to test you. You can also take precautions to prevent yourself from getting syphilis, including using condoms. And if you're in a longer-term relationship, you and your partner can get tested for sexually transmitted diseases to ensure that you won't be transmitting to each other inadvertently because you did not recognize that you had a sexually transmitted disease. This is particularly important for men with HIV infection, where a lot of the HIV providers often know that we recommend through formal guidelines that people with HIV get tested for sexually transmitted diseases, including syphilis, at least once a year, but may not implement it always. So you can remind your provider, and if you're a provider, you can think about ensuring that your patients are tested.
Makes sense. And for individual men who have sex with men, if they are speaking to their provider, how common would a test like this be? You know, is there any suggestions on how to raise this in a way that is more comfortable, more?
Sure, Steve. We think of syphilis testing as a routine, normal aspect of healthcare for gay and bisexual men. So your provider will be comfortable doing a syphilis test. There's two kinds. One is a blood test, which is just they draw blood and they send it to the lab and you can get a result relatively quickly. The other is if you actually see a sore, then you can actually get that tested through a swab. And that would be something that you would bring up with your clinician, or they would see it on a routine physical exam.
Great. And what can you tell us about what CDC is doing to address this intersection of HIV and syphilis?
Well, CDC is raising the alarm. We think this is really important, partially because of this intersection of syphilis among MSM who do and don't have HIV. It may be actually exacerbating transmission of HIV in these communities, as well as causing problems for people who get syphilis and don't get it treated. So we want to make sure that people know about it, that gay and bisexual men and heterosexual men and women throughout the nation know that syphilis has increased recently. Last year we had the highest levels in many years, over 77,000 reported cases of syphilis. And we want people to know about it, to protect themselves, and to get tested and treated for syphilis if they have it. We also are working with clinical training centers to ensure that providers who want to learn more about syphilis can get accurate information. And we have information on our website and treatment guidelines that cover syphilis.
Great. Well, thank you for joining us today here at CROI to brief our viewers about this new research.
Well, Steve, it's been great to be here. I really appreciate it.
Great. And viewers, to learn more about this topic, please follow us on the HIV.gov blog and learn more about the coverage that we have done here for the past several days at CROI on a wide variety of topics. You can catch up on all of that either on our Facebook page, where you can like or share these videos with other people, and you can also catch up with all of the coverage via the several blog posts that we've shared over the past 3 days here at CROI in Boston.